thought I had a sinus infection. Went to the local walk-in clinic and was being treated for sinus infection with steroids. Worked for went a couple days. That didn't seem to help, so went back. They tested again. Said, now you need to go have your COVID tested. So we rolled it on a Sunday. We come to Nashville and both tested positive for. Found out, I guess, late Sunday night or Monday that we were both tested positive for COVID. So beyond that, my symptoms were never breathing problems. I had severe headache, to where I was in severe headache and fatigue. I couldn't hardly walk around. I thought it was because of the headache and what I was considered a sinus infection in the beginning. But I stayed home with high fever for a couple of days. Woke up one morning and I was in the bathroom. And I got to look down and my toes were turning blue. So I told my wife, I said, hey, my toes are turning blue. She said, we got to go. She had an oxygen meter, checked my oxygen, and it was 54% at home. So yes, to get dressed, we got to go to the hospital. So we took off to Centennial, rolled down. I think she had already called ahead. Called ahead, told them we were coming. By the time we got to Centennial, my oxygen was down to 38%. I was turning blue in the car. Had to waiting for an ambulance, I wouldn't be here.
And still never felt short of breath.
Never felt short of breath. My head was still hurting. I was still breathing, just weak, but never felt the shortness of breath that everybody talks about. Mine was all head and neck. From that, I don't remember much. They rolled me into, I don't remember getting out of the car. She went in and talked to the ER doctors. They rushed me right in, got me intubated, and then spent a couple days in however many days in a chemical coma.
Well, like 16 days.
Okay,
something
yeah.
Like that. 16
Induced a chemical coma. Ended up some things were.
But the ventilator wasn't working.
Yeah.
He was starting to go down, and so they placed him on ECMO, and he, after a few days, started doing better. He was on ECMO, I think, for 4 or 5 days, and they was able to take him off ECMO. 2 days later, he was able to come off the ventilator. I think 2 or 3 days after that, he came off of oxygen, and he's, standing here now. So then he came here, and everything got really good once he came here.
Yeah. These guys right here, wonderful.
Mm-hmm.
They took care of me. First thing you want to do is here, what do you need to do? Let's see where you are. Let's assess you. Let's get, I remember the first thing I kept saying, man, I just want to wash my hair. I want to shower. And first thing, you want a shower? We'll get you one right now. Got it right here. So, it just started to click. This is where I needed to be. Well, we talked about going back, letting things kind of settle down, and me getting in a little bit better shape, and go back and thank everybody anyway. There's some things we still want to do for, like I said, the crew at Centennial. I want to do something for you guys too. I don't know what to do, but it was some, I've only been home since I left here Friday afternoon. Mm-hmm. Yeah, just trying to kind of get reacclimated after being gone for roughly 30 days, trying to get my life put back together and get moving around again. But, you guys do this day in and day out. For me, it was life-changing. And I think both of those experiences we went through. And I just appreciate you. I don't know what else you can do. Just means a lot. And I hope you guys realize it. Never take what you do for granted. As I was in the rehab room, I'm sitting there looking at me walking around. And I've never been a glass is half full or half empty kind of guy, but I'm looking around and realizing how lucky I really am. The things that came together, that a couple of minutes either way, 2 red lights, I wouldn't be here. Little things like that, and the fact that coming back to here, progressing me like we did, I'm looking around at the rehab room, and these guys are working with folks that have lost limbs. They're in a lot worse shape than me. I was the lucky one.
Expressing my appreciation, and she said, we're just doing our job. And I said, well, your job is saving my husband's life right now, and I will never forget that and forever be grateful for everything they did. And I hope that the world doesn't ever forget how important you guys actually are, because most days you don't think about stuff like that, but now it's super important. And you guys are saving. There's so many people out here that would be gone if it wasn't for you guys. Like, my husband would not be standing here if it wasn't for Centennial and you guys getting him back on his feet. And I appreciate you bringing him outside and letting me see him stand up for the first time. That was awesome.
You know, through this, from my perspective, as we watch all this stuff on TV, and even trying to hook up with doctors and set up appointments, everybody's running from this stuff. But you guys are standing there strong and taking it on. Yeah. I mean, it's like just like a fire. Everybody runs away from a fire, and firemen run in. You guys are the same way. You're running in to take care of the problem, and while everybody else is running away. And unless you've been down deep in it, you may not recognize that. But I just want everybody to realize, take this stuff serious. It is serious, and these guys are doing us all a good service.